Before we begin, I would like all of the listeners to know this scenario is based on a true story. Hi, Rose. The last time we spoke, you mentioned that you were experiencing some concerns about your adopted son. Briefly, let's go over his history. When we spoke, you mentioned he was adopted at age 3 and remained at home until age 21, when he was placed in a group home. Prior to his departure, he was diagnosed as having behavioral issues, developmental delays, and from the medical aspect, he was hypertensive. He had to leave home because of uncontrollable violence, inappropriate behavior with animals, and labile disposition. After he was placed over the course of 2 years, he was incarcerated 6 times and placed in 8 subsequent homes. At his last home, he attempted to strangle a worker with a telephone cord. At that time, he was admitted to a state residential inpatient psychiatric hospital. That was last May, and currently he remains as an inpatient. While he was at home, he was seen by multiple mental health providers and placed on medications to no avail. Currently, he is on 3 drugs related to his mental health. You have specific concerns at this point with his regimen and his medical care. Would you like to elaborate on those issues?
Hi, Liz. Yes, I do have some concerns on both the mental health and medical care that he is receiving. I'm frustrated because there is no effective method of communication between mental health, medical care, and as parents and guardians. Both my husband and I have medical or mental health backgrounds, so we're familiar with the issues surrounding both disciplines. When our son was admitted, the psychiatric hospital ran a myriad of tests. They did not do a lithium level in spite of his being on that medication. They told us he was Hep C positive, which was a new finding. Over the course of time, he became less responsive and began to have garbled speech. I contacted the social worker and the nursing supervisor, both of whom gave me lip service. Finally, when my husband, a physician, contacted risk management at the psych center, they found that he was severely over-medicated, experiencing tardive dyskinesia, and medications needed to be adjusted. On the second occasion, our son developed abscesses to the point that surgical intervention was required due to skin picking syndrome. He had 1 surgery after months of procrastinating. Within a week of returning to the mental health facility, that site became severely infected, and 3 other sites became infected that required surgery and a second hospitalization. When he returned back to the psychiatric center, I attempted to call him on 4 consecutive days at various times. He was always asleep, according to the staff. Finally, on a particular Tuesday, I was able to make contact. His speech was slurred. He was incoherent and literally walked away from the phone without saying goodbye. He spoke 3 sentences to me, and that was it. I contacted the nurse's station and the social worker, who once again dismissed my concerns. I knew something was amiss, but frankly I thought it was the Norco the psychiatric facility had prescribed, in addition to the Tylenol and ibuprofen the surgeon had sent him home on. All of these meds are toxic to the liver, and at that point we were really worried about the Hep C status and compromising his liver. Not only did they give him a narcotic, which the social worker didn't even realize was in their formulary, he was already prescribed medication from the surgeon. It was as if they were trying to do anything they could to keep him quiet and out of trouble at any cost. 48 hours later, he was in the emergency room in septic shock and was admitted to the medical intensive care unit. He spent 10 days in the hospital and was discharged last Wednesday. Today is Saturday, and once again he has been admitted with a fever of 102 degrees in an acidotic state. Because they've been unable to establish vascular access, because his veins are so constricted due to the sepsis, they're having to place a central line. I'm really frustrated, I'm angry, and I'm befuddled how any group of individuals, both medical and mental health, are so intent on not having adequate care to the point that a 23-year-old's health has been compromised to the point of extreme danger. Additionally, after testing and retesting, it was found that he does not have hepatitis C, but his liver functions are markedly elevated because they are giving him both oral and IM Risperdal, which has affected his liver. What does it take to have a board-certified psychiatrist follow lithium levels and liver function studies? Are they not supposed to know this can occur? Also, what about the primary care physician? Is he not obligated to follow up? What about the social worker? I feel like the right hand doesn't know what the left hand is doing at the expense of our son. In defense of the workers at the inpatient facility, I do understand how our son can be extremely manipulative and persuasive. That has always been a problem. I don't want you to have the impression that he is totally blameless in this situation. However, he is the one with the mental health issues, and they are the professionals. It's important that even in spite of the problems they encounter from the psychiatric side, they look closely into unusual complaints or behaviors, especially in light of his medical and surgical issues, along with my contacting them with my concerns. I'm not a parent or a guardian who spends all of the time on the phone criticizing their care. They do need to listen when a parent who has been with a child for 17 years of his life is telling them something is wrong, especially when that parent has the background that I do. They dismissed both their client and his family, which is unacceptable in this business, in my opinion.
First of all, I'd like to say what a great advocate you are. Unfortunately, until they totally understand the gravity of the situation, you might have to be the person they least likely want to hear from because they need to gain your trust again. Let's talk about interventions and what can be done to ensure that this will not occur regularly and you feel your son is in a safe environment. There are good social workers and then there are great social workers. Until we decide which team is over there, it may take a little more one-on-one on your part along with advocating for him formally. I have some ideas that I'd like to run past you and get your input as to whether this is feasible. I would like you to take some time and decide, and we can come to a formal decision at our next meeting. First, because you are 5 hours away from the facility, what would you think about attending weekly conferences via telemed or Skype? If you agree, I can assist with making the arrangements with the social worker there. This will serve another purpose, one that makes them realize there is a third party involved in watching. Second, because your husband is a practicing physician, perhaps he can discuss internal medicine follow-up for your son's hypertension and liver function studies. He may have a better rapport with the psychiatrist and that may be the way to follow up his lithium levels and administration of his medications. Since your son does have a guardian, you do have the ability to provide input. Next, it will be important to find out what the treatment plan is for your son with regard to social work. What role is the social work department taking on? Who ultimately is in charge of his case, given that it's not a typical straight mental health problem? How can we ensure that all parties are communicating and listening so that your son's care is the primary concern and everyone is looking for his best interest? That may require a face-to-face meeting where you have to visit the facility. It may be difficult, but not impossible, to get the doctor, the psychiatrist, the social worker, and his parents at a meeting together. Finally, even when this plan is in place, it will be important to do spot checks, so to speak. You mentioned that you were calling at various times throughout the day to ensure that he was not in his room sleeping or ill. This may have to continue for a while until they regain your trust. I'm so very sorry to hear that he is once again admitted, but since you will be going down to the area after this interview, to the hospital, this may be an opportune time for you and your husband to contact the facility and arrange for a meeting. How does this sound to you?
Yes, I am very much in agreement with your suggestions. I would like to speak with my husband and see whether he may have anything else to offer. In the meantime, we'll plan on contacting the mental health hospital.
When you return, give me a call back and we will arrange for to meet again and plan the agenda.
Thanks, Liz. I really appreciate the time that you've spent on this.
And thanks for your time as well.